Pattaya City Expats Club is a non-profit social organisation and our speakers are volunteers. The club as such assumes no responsibility or liability for the professional reputation of or the quality of services provided by the speaker today.
Not one but two wonderful doctors from the Bangkok Pattaya Hospital, and Dr. Borwonkhun was gave a wonderfully informative talk on diabetes and the consequences and what causes it and what sort of treatments are available. So this is a massive worldwide problem.
Yes, exactly.
And it's getting worse all the time in Thailand.
Exactly.
So when we talk about things that cause diabetes, we're often talking about high glycemic index foods, right?
Mm-hmm. Yes, correct, because people eat bad stuff lately and it's more easier to eat something with high sugar or high fat, so people getting fatter and fatter and then develop diabetes in the end.
Yeah, and of course it's sometimes hard to convince, for instance, Thais that white rice could be a problem, right?
Yes, it might be most of the time. Mm-hmm.
And I thought, I learned a lot today. I learned, for instance, that the worst rice you can eat is sticky rice, and I like sticky rice.
Okay, if you could not control the diet, you may need more tablets. So you need to choose by yourself which one would you prefer.
Yeah, well, I don't have it very often, but I would have thought it was the same as white rice, but it's worse than white rice.
Yes, it's even worse than white rice.
I wonder why that is. So, of course, the biggest recommendation for avoiding diabetes is control your waistline, right?
That's correct. Get your slim and not getting fat by any means by diet control or do exercise.
I noticed that intermittent fasting is very popular, becoming increasingly popular.
Yes, it is, but it doesn't make any difference because if you eat low calorie 3 times a day and you eat intermittent fasting, just like some people eat 8 hours, fast for the rest of the day 16 hours, if you eat the same amount of calories, it doesn't different. So
it all comes down to calories in and exercise out.
Yeah, correct.
And metformin, like I've even heard about people who are interested in living long lives who don't have diabetes who take metformin.
Yes, there are several studies that have taken metformin before you getting diabetes to prevent. Yes, it have effective about 20-30%, but if you get slim, keep your BMI lower than 25, it's more than 50% effective. So yes, you can take it, but it's not as good as weight control.
Yeah, and so what are some of the new treatments that are coming up for diabetes?
Oh, there will be a lot. There are tablets, there are weekly injection, there are once a week insulin, there are a lot of things in the room.
Ozempic is the new trendy drug, not just but also for weight loss. Yep. Like it's going crazy in the States. All these people are having Ozempic to lose weight.
It was firstly designed to be diabetic treatment, but lately it had been approved for the weight loss. So it's now officially weight loss medication. So, but they use a different brand name. There will be a Wegovy, which will be launched maybe next year. But right now in the US, they launched already the Wegovy. So they are the same medication.
And I guess because it's newer, it's more expensive than metformin. Is that right?
A lot, yes. A lot.
But you can eat the same amount but take Ozempic and lose weight.
You mean...
How does the Ozempic work in terms of losing weight?
Let's say about 10% weight loss in 3 to 6 months.
Oh, right, just taking the tablet, not changing your diet.
Ozempic is injection, but right now they have the Ozempic in the form of the tablets already, but the dose need to be a lot higher, and right now it have not been approved to use tablets, the Ozempic form of tablet for the weight loss, but I believe in maybe 1 or 2 years they will be approved.
So this is the key. You can control whether you get diabetes or not. Of course, there is such a thing as genetic propensity, etc. And of course, the very unfortunate diabetes 1 people. But more and more, really, it's in your hands as to whether you get diabetes.
So it depends on the food you eat and the way you live. So if you can control the food, you don't need a lot of tablets. It depends. It's a balance.
So there you go. It's a balance, all right? So, what do you recommend to people as symptoms they might have diabetes?
So let's check if you have the symptoms. You have a lot of urine, you have feeling thirsty, unexplained weight loss, and even if you have family member with diabetes, please go to the hospital to check. The blood work can tell us earlier than the symptoms really happen.
Yeah, there you go. So really, it's such a terrible thing to get diabetes. So if you can, for instance, get a blood test to tell you you're pre-diabetic, that can be a wake-up call, right?
That's correct. That's correct.
Well, I want to thank the doctor for just a wonderful talk and so informative. And thank you so much. Yep. And I look forward to never having to see you as a patient. Okay. But thank you so much.